Now we know that in FASD, the brain is processing information differently. This is really a brain-based disorder, and that's the most important thing for people to understand. It's also the most important thing to help families understand that the behaviors that we see in FASD most commonly are due to the way the brain is processing information. They are not purposeful, willful behaviors, so the approach to those behaviors needs to be different. So again, I thank Bill because he helped me think differently and look differently about people. And this is all about thinking differently. This is all about looking differently at what's going on with this individual. And I also put a picture of him up because nobody would see him in their classroom and say, this is a young man with this disability. And one of the issues, of course, we know in FASD is that if people know a little bit about it, they know about the facial features of fetal alcohol syndrome. They know that people with fetal alcohol syndrome may have a small head size. They may have an IQ under 70, but we know the majority have an IQ over 70. We think if we don't see those symptoms, we're not seeing any of the ill effects of alcohol. We think that the effects of crack cocaine, marijuana, meth are more serious than alcohol, and that's wrong. Alcohol, by far, we know, causes the most serious lifelong neurobehavioral effects. But again, for the vast majority of people, you can't look at them and say, this is a person with this disability. So if they look okay, they sound okay, they're really bright, and they can repeat back what they need to do, or they can repeat the rules of the classroom, then when they break them, clearly they're doing this on purpose and need to experience the consequences. And that's not it. And he also taught me how painful it is over the years to live with a hidden disability. To be told over and over and over again, from early on in life, all the way through, in every setting, you're just not trying hard enough. You can do it if you want. You just have to put your nose to the grindstone. You have to really work at it. You can do it. And the problem is they can't. Not the way we set it up. So we have to rethink our practices, and we also have to rethink this concept of evidence-based practices. One of the issues with evidence-based practices, and we really talk a lot about them, is that we think that if something is an evidence-based practice, which means that it has been tested in a research environment, not necessarily in real life, but in a research environment, and has been shown to be effective in the majority of people, that we need to use it with everybody, and if the people don't respond to it, then they are non-compliant, uncooperative, resistant, manipulative, and unmotivated. And there is no evidence-based practice in the world that I've come across yet that works with everybody. And the key really is, yes, you use your practices with most of the kids because they work well. The issue here is when it's not working, the first question we should ask is, are we missing something here? Rather than, they're just uncompliant, uncooperative, non-compliant, and unmotivated. Are we missing something? That's really the question we should be asking. If it's not working, what do we need to modify in order to help this person be successful?